Welcome to In the 661 Youth Voices of Kern, where we're discussing topics and issues that are really relatable to everyone in our community, but specifically we really want to target our youth and kind of get a discussion going around them. Marisol Guillen is with Community Health Initiative. Marisol, thanks for joining us.
Thank you for having me.
Thank you for coming. So talk to me about what Community Health Initiative is, first off.
Community Health Initiative is a program here in the community that focuses on serving the community to access healthcare. You know, back in the days, our program used to be Children's Health Initiative, where we used to help kids enrolled in Medi-Cal through the Healthy Kids program. Not just that, but also helping them with booking appointments to their medical doctors, to their dentists. After the Affordable Care Act, our community outreach efforts expanded to offer services to the whole community. So our name changed to Community Health Initiative.
So you went from targeting kids to targeting everybody, so to speak, to get everyone insured.
Correct. And as a result, we have been able to enroll many families and individuals that before didn't have health insurance, and now they're going to seek medical attention.
Talk to me about that, because when the Affordable Care Act has been a controversial topic, right? You know, when it first came to be, there were a lot of folks saying, well, you know, we shouldn't be heading down this road, that you know, healthcare is not a right. What do you say? Is healthcare a right?
Well, we have our community as an example. A lot of people depend on programs like Medi-Cal or Cover California for their lives, you know. Before, they didn't have the health insurance. And now that they do, they're seeking the help. They're going to their preventive exams. They're seeing doctors on a regular basis, especially for those with chronic diseases like diabetes, cholesterol, high blood pressure. They're seeing their doctor on a more frequent basis, and they're managing their illnesses, you know.
So you're seeing people not only getting insured, but then actually using those services before they were not actually getting those services.
Correct, and that's what we are here to help. For those people that are not accessing their health insurance, we want them to make the most out of their health insurance. We can assist them with not just the enrollment and renewal process, but also booking appointments. If they're experiencing any barriers when accessing care, we can help them. We can advocate on their behalf so that they can receive the care that they need.
What are some of the barriers that you and your team see in terms of people not signing up or not wanting to sign up for health insurance?
It can be as simple as the language barrier, you know? A lot of people don't understand the whole process. Healthcare is really complicated, so we want to make it really easy for them to understand. And for that, we also oversee a committee. The Outreach, Enrollment, Retention, and Utilization Committee was formed to create partnerships with partner agencies from here in the county so that we can all work in the same message. You know, healthcare is complicated as it is. So if we have the same message for everyone in the community, it's easier for community members to understand. Okay.
So, so language is one. What's another? It's just trying to figure out how to access the insurance to begin with. People don't even know where to start.
Yeah. And with this committee, we have developed different educational material that makes it easier for community members to understand.
Okay. And so after the Affordable Care Act was enacted, we saw a lot of people, a huge spike of people suddenly being insured. What has that done for you guys and how you pivoted and changed, you know, how you execute your programs?
Yeah, so the uninsured rate really dropped to a historically low. So we can see the decline in uninsured rate across all ages, all racial and ethnic groups, you know. So it has helped for us to create more material, educational material that can be in different languages, that it can serve the community so that they can access the healthcare that they deserve and need.
One of the other challenges on the other side is once you get people insured is getting them access to actual providers. And we know that there is a shortage of primary care doctors in this community. It's hard to access clinics sometimes in rural areas, you know, that are outside of the metropolitan Bakersfield area. How do we start fixing some of those problems? So not only do we get them insured, but then they actually have a chance to get to a primary care doctor and be seen and use the insurance the way it's supposed to be used.
Yes, we've seen that change. A lot of people are enrolled now, but some of them don't use it. So what we do is post-enrollment support. It's all about the education to the community. Yes, we do need more doctors here in the Valley. We have a teaching center here in the Valley, and we need more of those. We also develop material that can be easy to learn for people to get more information about their health insurance.
Okay. So, I mean, you're kind of basically working on an education campaign. What areas are you targeting right now?
We know that a lot of people here in the county are enrolled in Medi-Cal, so we have a series of flyers which describes all the benefits under Medi-Cal. So Medi-Cal covers dental benefits, vision services, physical health, and mental health services. So that's our campaign right now. We're emphasizing all the services that Medi-Cal covers. Sometimes a lot of clients come and say, oh, Medi-Cal doesn't cover, but it's just the lack of understanding of how the program works. You know, there's an in-network providers. They need to know where to go before accessing those health services. If not, they're going to be faced with it's not covering their services.
Right. So understanding that if you have insurance, what an in-network. I mean, because healthcare is it's one of the most complicated things, around there. The way I describe it kind of to folks is like in Amazon, when you go online, you order something, and you know what you're getting, and you know how much it costs, and you know when it's going to be delivered to your house. It's very intuitive. But healthcare, you go in not knowing if it's how much you're paying for it, who's going to pay for it. It's a complicated situation.
Yes, it is very complicated, and we have tools that can help them know what to ask at the doctor's office, different steps that they should be taking. You know, if they don't like their doctor, if they don't like their primary care physician assigned, they have every right to change the doctor. You know, sometimes it depends as if the doctor is close to home or if it's a female or a male doctor, if they speak my language.
Right.
You know, so they have the right to change that doctor. We also tell them to be prepared, you know, write a list of health concerns.
Be your own advocate, right?
Exactly.
When you go in there, come in and say, this is what's bothering me, or these are things I need to have addressed, and not hope that the doctor
and just answer all the questions to the doctor honestly and continue the plan that the doctor gives you. It's really important for community members to follow directions from the doctors. You know, if the doctor prescribes you something, take that prescription form to the pharmacy as soon as possible so that you can start your treatment. If you need a follow-up appointment, make sure that before you leave the doctor's office, make a new appointment to get your treatment.
Well, Marisol, thank you so much for talking to us about some of the work that the Community Health Initiative is working on. I really appreciate you coming in.
Thank you so much.
All right, and thank you for joining us for In the 661 Youth Voices of Kern.